Hi there. My name is Dr. Emma Wainaina, pediatric dentist and orthodontist, and the CEO of Dentplan Dental Surgeons, where your smile, your personality, and your self-esteem is our priority. Today I'll be discussing orthodontic treatment, or what's more commonly known as braces. So why are parents complaining that children are requesting for braces as a cosmetic treatment? The answer is no. Braces are designed to actually align your teeth, to balance your jaws, so that you're able to actually have both your right and left jaw meeting at the same time with no pressure or tension on your joints, because we don't want you to develop arthritis in your joints. And we also don't want you having crooked teeth, but you can't brush, and therefore you have accumulation of tartar behind and between your teeth, causing gum disease. Later on, you're going to have tooth loss and, of course, dental cavities. So what type of braces are there, and why are braces required? So I'll start with why braces are required, and I'll use this example. So in this case, you can clearly see that the teeth are crowded and displaced, with some displaced outward and inward. And you can clearly see from the lower jaw that the teeth are crowded on the anterior segment. And when this child tends to bite, the upper teeth don't meet, so this child can't bite into an apple. And the teeth at the back are also quite unbalanced because his chewing efficiency is actually not good. He finds himself biting more on the right, and the teeth are floating more on the left. So once we do orthodontic treatment on this child, he'll be able to actually bite his teeth together and have all the teeth aligned, and he'll be able to improve his brushing efficiency, and therefore will not have any gum disease. What type of braces are there? We have metallic type, and we also have the clear type. Okay, these are the railway tracks that people talk about that are on children, and sometimes you can have clear ones if you do not want the metallic ones. Currently, we also have invisible braces. We call them Invisalign. We actually put them at the back of your teeth, and these are invisible from the front, and we're able to align your teeth quietly. We use this especially more in adults who want to keep it discreet as we align their teeth. For more information, you're invited to come and visit us at Dentplan Dental Surgeons, where every smile counts.